Hello everyone. We do a lot of surgery about penile enlargement. You can find a lot of information about it on my website, peniscerrahisi.com. There are also 13 videos on penile enlargement for about 3.5 hours. But there are still some things that I have to mention. Since the patients ask me a lot of questions, I take notes on them, and some patient misunderstood some of the things I have been explaining, so I had to take another video. I will looking at the text when I explain them now. There are some questions which are asked right after the surgeries. For example, I have a swelling underneath my penis. I wonder if it is because of the fat accumulated in the part. It is very natural for the first few days because there will be an edema after the surgery. Edema is a type of serum that causes a swelling inside the tissue. Penile tissue is a dangling tissue. Since edema consists water inside, it will pile up the bottom. It filters downward and piles up at the glands. So it's normal to swell and cause an edema. Don't be surprised if you see it. And this edema is also temporary and dissolves in a couple of weeks. Patients also get very surprised when they open up the dressing. The surgery was good, but the suture looks awful. It looks like it has rot inside. The suture is a must for surgery, of course. We have to go inside since we will cut the suspensory ligament. And in order to elongate the skin, we have to put stitches that looks like the letter Y, and we do it in a way that it causes blisters. It's called an everted suture. Then the scar tissue heals. The blister will go away if we do it evenly. The patient will like it since it will look like so straight. Patient also called the gluing. If we stir it evenly, the area will subside and it will look like a pit. So the reason we blister it is to make it look straight after the healing process. So we consider the outcome, but when the patients see it blistered, they tell me that the suture looks bad. There is also something else. Patients say we had the operation for elongation, but the penis does not look as long as it did before when erected. It even got shortened. Look, you compare the early periods before and after the surgery. Before the surgery, the tissues are soft and easily erected, but after the surgery, there will be some stiffness at the penis and at the base. Tissues get rigid when they are in the healing process. You cannot expect it to recollect itself right after the surgery. We free the penis from the bone, but tissue loses its elasticity and gets rigid. It needs to heal, and it will be the same way as it was before after 6 or 9 months. You will surely see that it has elongated because we free it from the bone and move it forward. So you will see the result, but you need to wait for it to gain its elasticity again. So you need to be patient, and you shouldn't compare the soft tissue that you see right before the surgery. The rigid tissue will need to soften first. Sometimes the patients say that it's not as sensitive as it was before. And this surgery does not cause such a thing before we don't work on any vein or nerve. The reason is that when we do fat injection for the thickening, penis swells up a bit. So if we apply something over there, it will also cause that. But it will last just a couple of days. If you bear with just a few days, it will go away. Just a week or so. Please do not be surprised, it's not permanent. A lot of people ask me about it. We told them to open up the dressing, and on the 5th day they call me saying there is some loss of sensitivity. You have just had the surgery, it's normal. It's swelled up because of the fat injection. So it is completely normal. Some patients also say that there is some pain when they are having sex after a couple of days of the surgery. There is also a reason for that. We put sutures at the back of the penis after we free it from the bone to move it forward. Separating it from the bone is not only enough. When the penis is erected, the sutures strain a little bit, then it causes some pain. After a month, you can start to have sex, but it will cause some pain in the beginning. It's not permanent. This is not permanent. I have heard that patients won't be having any pain after a few intercourse sessions. So you need to be patient. After all, you have had an operation from the penile area and it has been only a month. Patients want to use their penis, but it surely will cause some pain in the beginning. Please be patient, but the pain goes away decreasingly. They say that it goes away after the 2nd or 3rd time. It is not permanent, and some patients ask if the bleeding is normal after the surgery. They say that it's much as the underwear. The most problematic part is the sutures at the base of the penis. There is a suture shaped like a letter Y, and right in the middle, there is a part that takes very long to heal. There might be some opening in that area, especially if the patient smokes. If he smokes, that probably will happen. I want them to take photos to check the suture. If it looks serious and it needs a medical dressing, I told them how to implement it. And with the dressing, it usually gets better. We haven't had a case that needs a surgical intervention. We solve it with dressing, but if you have bleeding in the area, you need to apply Baticone and put some gauze on top of it. It is an easy procedure. It will get better in time. One of my patients told something that I would have never think of it. It is really interesting, but there's also no solution for that. He said, you perform the surgery and send the patients back to their hometown. If they go into the X-ray machine at the airport, it is an enclosed machine, so if they go into an X-ray machine, people can see the dressing inside. So, police take the patient to another room to check it out. Because the police want to check if they carry an illegal drug or something there. I would have never thought about it. Some of my patients experienced that. Even if we give the patient a medical report about it, the police will still want to check it. It's an interesting thing, but sadly, we don't have any solution for that. Even with the medical report, police will still check them out. They will try to look into the dressing, and when they see that you have had an operation, they will release you. None of my patients were stuck at the passport check, but one of my patients told this story. But you cannot do anything about it. If they see the dressing, they will check you out, then they will release you. We have thought about giving a medical report to the patients, but I don't think it will help. They will check you out anyway. Sometimes my patient plan coming to clinic with their own car, and they ask me if it is okay to drive after the surgery. I recommend them not to do that. Of course you can drive, and I don't think there will be any problem since we send the patient after they come to themselves. But let's say you were driving and you had an accident. You would be guilty if you drive the same way you have been under anesthesia. You will automatically be considered guilty. So I don't recommend it. Please do not drive after the surgery. Don't do it even if you can. If someone hits your car, then if they see that you have been under anesthesia on that day, you will be only one to be blamed. So I recommend you not to drive after the surgery. You can ask a friend to drive you home, or you can call a cab or something else. You need to plan it before the surgery. And this is the most asked question, and also the question that awaits a reply most. To be honest, I also need an answer for that. As I've told you before, this is the most frequently question, and I don't know the answer to this question as well, and I'm curious about the answer too. So, patient asks if the elongation will be visible during the erection, or will it be visible only when it is soft. I actually wrote about it on my website, but the patient misunderstands it. They think the elongation won't be very visible during erection. That's not true. We get feedbacks from the patients, sometimes with texts and sometimes with emails. Some say that they are happy with the result and elongation is visible when it is on erection and when it is soft. But some say that it's not visible during the erection. We don't deny that. Some say that it is not very visible during the erection. Don't mistake that for thickening. Thickening is visible in any case. We inject 60 cc fat around the penis and it stays there. So you can see the thickening. But I think sometimes elongation cannot be very visible because of the thickening. And also, since we separate the penis from the bone, it tries to approach to the bone when it is erected. Then it may be retract just a little bit. There is not a clear scientific study on that. You can also find it in the textbooks. There is no clear scientific study on the elongation size. It is really difficult to measure that precisely because patients both in Turkey and abroad usually don't go to the controls after the surgery and don't send a photo with an erected penis. Some of my patients ask me this question and I told them all about it. They said, if you don't have any data, this is not our guilt. In order you to have a collective data, we should be sending you the erected penises photos. Some says, I will take the measurement and send you the photos so you can have a data on that. But none of them sent me a photo or took a measurement. They were very ambitious about it, but nobody bothered to send me the photos. One day, a young patient of mine came to my office saying that he took the measurement and also took photos. when the penis was on erection, and he showed me the photos on his cell phone. I asked him to send me the photos from WhatsApp, and I told him to take more photos after the surgery, then we could compare them. He didn't send me the photos. I reminded him that on the day of the surgery. He told me that he had forgotten about it. We performed the surgery. He came for his controls 6 months later. Then after a year, he came for something else. I reminded him the photos every time I saw him. I also told him that it hasn't been a month. If you take photos, then send them with the ones you took before the surgery. It would mean so much to me. Please send me the photos. Again, he said, sure, I will, but he didn't. He never sent me the photos. None of the patients send any photos. They just don't. Even in the United States, patients go to another state to have the surgery. Even if there are surgeons in their hometown, they don't want anyone to hear about it. So our patients also come from different cities, but the surgery and for the surgery, and they don't come for follow-ups, just like in the United States. So sadly, there is no study about the measurement or so. It is really an unfortunate fact. If the patient had helped us, we would have collected all the data about it and seen that what kind of contribution would be helping the surgery, but nobody helped us about that. So this issue is a kind of in the dark. But saying that there will be no elongation during erection is wrong. It's not true. We have a lot of patients that see the difference. Only some of them say that it's not very visible, but it has nothing to do with the thickening. You can also see it in any way. We only have patients who say that it's not very visible during the erection. Not everyone says that. A lot of them say elongation and thickening are visible during the erection. I'm very pleased to hear that. Thank you. One of them said that he felt like he promoted to the Premier League. So it is not true. The elongation measures during the erection are kind of a dark since there isn't any study on that. And only a few patients say that they do not realize the elongation very much during the erection. So we have also made it clear. Patients are also uncomfortable with surgical scar. Since this is a surgery, we cannot do it without leaving any scar. And a small scar is left because we elongate the skin at the back of the penis. Penile tissue is moved forward, so we need to elongate that skin too. Then a small scar shaped like the letter Y stays there. But to be honest, it is not very significant. You need to wait for the healing process. It will be a little swollen first because we use the inverted suture method. You need to wait for 6 or 9 months, and there is no other solution. It will be quite obscure and you won't even see it when the pubic hair is grown. So it's not a serious thing. And some patients ask that, why do we elongate the penis not from the bottom but from the back? Because we don't need to do that. Scrotum is really loose skin and it helps the elongation. Since the penis is separated from its back and the skin at the top is rigid, we need to perform the elongation on that. These are the questions that come to my mind, and I'm going to pick them up in a place. Thank you very much for watching me.